Yep, come on in.
Hi, good evening. How are you?
Good, how are you?
I'm good, thank you. My name's Jessica Prino. I'm a nurse practitioner that's going to be examining you today.
Okay.
Can I have your name and date of birth?
Luke Smith, and it's 2/21/87.
Okay, Luke, what do you do for a living?
I'm a sheet metal worker.
Sheet metal worker, and are you married?
I am.
Okay. What's your reason for seeing us today? What's your reason for seeking care?
Just a wellness check.
Wellness check? When's the last time that you were examined?
Well, I had a physical about a year ago,
Okay.
but that was just quick in and out, and
Okay,
and
that's
then
fine.
10 years from that, probably.
10 years from
yeah.
that, okay. So I'm gonna go into your comprehensive health history since you're a new patient to us. It's gonna seem like a lot, but the better that you answer, the better care I can provide for you, okay?
Okay.
So we're gonna go in your past medical history. So we're gonna talk about past like injuries or surgeries and things like that. So do you have a significant past medical history?
No.
Okay. Have you had any injuries? Have you had any breaks? Any?
Yeah, actually I had my jaw broke,
Okay.
and then
When was that?
probably 2007, 2008.
And what was the treatment for that?
We had some x-rays and it was fractured, and actually let it heal on its own.
Okay, so the outcome is okay. You don't
Yeah.
have any deficits with the jaw.
No, everything feels okay.
Okay.
And then I actually had a kidney stone probably 10 years ago. And that was-
Like 2010.
yeah, 2010, 2011.
Okay. Were you hospitalized for that, or was there any procedures, or did it just?
Nope, I was actually able to pass it on my own, and everything's been okay since.
Okay, so no hospitals, no surgeries, kidney stone, and then the broken jaw.
Yep.
All right, any medications you're taking on a regular basis,
No.
such as anything over the counter as well, like ibuprofen, Tylenol, herbs, or supplements?
Nope.
No? Do you have any allergies that I should know?
I do not.
And non-seasonal environmental food or drug?
Nope.
Okay. To your knowledge, are you up to date on your immunizations?
Yeah, it should be.
Should be. Okay, do you get flu shots?
I do not.
You don't. Okay, any exposure to communicable diseases that you're aware of? Any exposure to flu or the coronavirus or things like that?
Not that I'm aware of.
Okay. So do you use any complementary therapies such as massage or chiropractics or acupressure?
I do not.
Okay. So now we're going to delve into your past family medical history. And we're going to start with your grandparents on both your parents' side, and we'll work our way down. So
Okay.
Let's talk about the grandparents on your mom's side. Is there any past medical history that you know of with those?
Yes. My grandma, she's still around. She's had a stroke, and then my grandpa, he passed away of lung cancer.
Okay. What about on your dad's side?
My grandma, she had a stroke as well, and then my grandpa on his side actually passed away from cancer as well, but I'm not sure what kind.
What kind? Okay. So your grandma on your dad's side is still alive?
She is.
Okay.
Yep.
What about your parents? We'll start with your mother.
Okay. She has diabetes, and she has had a stroke as well.
Okay. And your dad?
He has heart disease.
All right. Aunts and uncles, any pertinent medical history that you know of there?
Not real sure with any issues with them.
Okay. Do you have any siblings?
I do. I have a younger brother, and he's had a stroke actually just recently,
Okay.
and he's recovered from that. And
All right. What about your children? Do you have any children?
I do. Yep. I have a 9-year-old daughter and a 3-year-old son.
Do they have any medical history, or they have good health?
No, they're good health.
What about your spouse?
She's good health as well.
Okay. Are you concerned about any family illnesses?
No. Sounds like I need to be concerned for the stroke.
Got a pretty significant family medical history for a stroke, that's
Yeah.
for sure. So it's good that you're coming to us and kind of getting set up with a provider. So I'm going to talk about your relationships with your family. Do you feel like you are satisfied with your relationships with your family, your immediate family and your extended family?
Yeah. Yeah.
Do you feel like you're satisfied with your spouse and your living arrangements?
Yeah, I have a great family.
Okay. And now you told me you were a sheet metal worker. How long you've worked there for? How long did you say?
I've been doing it for 15 years.
15 years.
Yep.
Are there any occupational risks associated with this job?
Yeah, cuts, scrapes, potential
A
for
lot of-
anything. Yeah.
I'm sure that you're pretty safe and follow all precautions when it comes to that. As far as your economic status, do you feel like your financial status is adequate and that you're able to pay for your own medications? Okay.
Yep.
Do you have health insurance for both primary and inpatient care?
I do.
All right. And what is your educational level?
I served a 5-year apprenticeship and then have an associate's.
Okay, that's good. We're gonna go into your social history now, okay, and we're gonna talk about past and present habits. Do you use alcohol?
I do not. I mean, maybe 1 or 2 beers a week.
1 or 2 beers a week, okay. What about tobacco products? Any past or present tobacco use?
I was a smoker. I quit. It's probably about 4 years now.
And before you quit, which congratulations, before you quit, how long did you smoke for?
Probably 13, 14 years.
And how much did you smoke during that
About a
time?
pack a day.
A pack a day, okay. Do you drink any caffeine containing beverages?
Yeah, coffee in the morning, maybe 1 or 2 cups.
Okay. Any recreational drug use?
No.
We'll talk about your sleeping patterns now. Any difficulty falling asleep or staying asleep?
No, I fall asleep pretty easy. I do toss and turn quite a bit though.
Okay, so there's some disturbances in your sleep. Okay, how many hours a night do you think you get?
5 or 6.
5 or 6. Do you get regular exercise or activity?
Yeah, through work, I'm pretty much on my feet all day long. And
Okay. What do you do for like leisure activities? Do you?
do a lot of recreational. I like to hunt, fish,
Okay.
golf.
So describe to me a typical day for you. Like, what do you do from when you wake up to when you go to bed?
I wake up, work 8-10 hours a day, and come home and spend the time with the wife and kids, and they keep me pretty busy until bedtime. And then after that, I'll spend some time in the garage working on things that need to be done, and
Okay,
that's it.
sounds good. Now we'll talk about your nutritional and daily intake. Can you describe to me what you've eaten in the last 24 hours?
This morning I had yogurt and a granola bar and a pear for breakfast.
Okay,
For lunch I had steak tacos, rice and beans, and then for dinner I had pizza and breadsticks.
now is this pretty typical of your daily intake?
Yeah, it's pretty standard.
Pretty standard. Now how many times would you say you eat out per week?
Right, 6-7 times a week.
6 or 7 times a week, okay. Any special dietary practices that you follow, like Atkins or keto or
Nope.
lactose intolerant, lactose free or gluten free?
I'm just
No.
trying to cut back on sugar.
Okay, good. How much stress would you say you have in your life? Do you feel like you have a moderate level of stress in your life or a great deal of stress?
No, I mean, everybody gets stressed out occasionally. Mild stress,
Mild stress? Work stress, okay. Do you feel like you manage your stress well on your own?
Yeah, I think so.
Okay, what do you do to decrease your stress?
Like I said, hobbies. I like to hunt and fish, and it kind of calms me down and
Okay.
takes me away from it.
Have you ever felt the need to seek outside help for stress management, such as clergy or professional help?
No.
All right. So, have you or any of your family or friends witnessed or been exposed to violence or abuse?
No.
You feel pretty safe in your environment?
Yeah.
Okay. Do you feel satisfaction with your life in such that you have accomplished things that you've wanted to do?
Yeah.
Feel life satisfaction? Okay.
Yeah.
We'll go ahead and talk about safety. Do you use proper safety measures with yourself and in your home? Like in your home, are there Smoke alarms or CO2 detectors, are the guns, if you have guns, are they locked up?
Yep,
Okay.
everything's safe.
Alright. Any environmental hazards in your home, such as exposure to lead, secondhand smoke pollution, crime?
Nope.
No? Okay, pretty safe. Do you have any religious affiliations that I should be aware of, such as ethical or cultural beliefs or traditions?
No.
No. Okay. So now that we've gone through that, I'm going to go over a review of systems, which is basically asking you questions about your body. Okay, and I'm going to start from your head to your toes, and I'm going to ask, do you have any fever or chills?
Nope.
Any fatigue or night sweats?
Nope.
Any changes in your weight, whether increase or decrease?
Nope.
Okay. Skin and nails. Any changes in your skin or nails?
No.
Do you use sunscreen?
I do not.
Any changes in your hair quality or distribution?
No.
Do you use corrective lenses?
Yes, I wear contacts and glasses.
Contacts and glasses. When was the date of your last eye exam?
Probably about a year ago.
All right. Any visual disturbances such as floaters?
Nope.
Any eye infections?
Nope.
Okay. For your ears, any hearing loss?
Nope.
Any pain or discharge from the ears?
Nope.
Any tinnitus or ringing in the ears?
Nope.
Any vertigo?
Nope.
Use of hearing aids? Do you use any hearing devices?
No.
Okay. For your nose and sinuses, any sinus pain or infections?
Nope.
Frequent nosebleeds?
No.
Frequent colds or runny noses?
No.
Okay. Mouth and throat, when was your last dental exam?
That's probably coming up about a year as well.
Okay. Do you have any missing teeth or dental problems?
I do not.
Bleeding gums?
No.
Do you brush and floss regularly?
I do.
Sore throats?
Nope.
Difficulty swallowing?
Nope.
All right. Now for your neck and your lymph nodes. Any stiffness or decreased range of motion in your neck?
No.
Any swelling of the neck or lumps or tenderness that you've noticed?
Nope.
For your breast and axilla, any swelling of glands under the arms?
Nope.
Any lumps or soreness in the breasts?
No.
Any discharge from the nipples?
No.
For your chest and respiratory status, do you have a cough or any sputum production?
I do not.
Any shortness of breath?
Nope.
Wheezing?
Nope.
History of asthma or pneumonia?
Nope.
Or bronchitis?
Nope.
Okay. Cardiovascular wise, we're going to talk about your heart. Any heart problems that you're aware of?
No. Nope. Nothing.
Okay. Hypertension or chest pain?
Nope.
Any murmurs or palpitations?
Nope.
Any swelling in your hands or feet?
Nope.
Any exercise intolerance, like chest pain when you're exercising?
No.
Have you had your cholesterol levels checked?
I have not.
Okay. Gastro-wise, any pain in the abdomen?
Nope.
Okay. Any nausea or vomiting?
No.
Any diarrhea or constipation?
Nope.
You have regular bowel habits?
Do.
Okay. Any rectal bleeding?
Nope.
Stomach ulcers?
Nope.
Gallbladder disease?
Nope.
Okay. Urinary wise, any pain with urination?
Nope.
Okay. Any pain in the flank, which is the back, like when you had your kidney stone?
Nope.
Any blood in the urine?
No.
Do you have urinary frequency?
No.
Any incontinence or dribbling?
Nope.
Any penile discharge?
Nope.
Reproductive wise, any fertility issues that you've had?
Nope.
Do you perform regular testicular exams?
No.
No, not really. Okay. Have you had a prostate exam? When was the last one?
During that physical.
So about a year ago?
About a year ago, yeah.
Okay. For your sexual history, how many current partners sexually do you have?
Just the one, my
Just
wife.
one wife, female.
Yeah.
Do you find your sexual encounters enjoyable?
Yep.
Do you use contraceptives?
I do not.
Okay. Musculoskeletal, any pain or stiffness in the joints or back?
No.
Any limited range of motion?
Nope.
Swelling, weakness, or difficulty walking?
Nope.
Neurologically, any history of head injuries?
Nope.
Loss of consciousness?
Nope.
Numbness?
Nope.
Tingling?
Nope.
Tremors?
Nope.
chronic headaches?
No.
Do you find that you have irritability or mood swings?
No.
Memory impairment?
No.
Okay. The last point is endocrine and heme. It's any history of anemia, sickle cell disease.
Nope.
Do you have a bleeding tendency or have you needed a blood transfusion?
Nope.
Any thyroid problems that you're aware of?
Nope.
Any sensitivity to hot or cold?
Nope.
Any excessive thirst or urination?
Nope.
Any excessive hunger?
Nope.
Okay. So now that we went through your thorough health history, we'll now perform the physical exam.
Okay.
Okay, so I will go get you a gown and we'll get you ready.
Perfect. Thank you.